Okay, so in this chapter, we're going to be talking about local anesthetics. And what you may know about local anesthetic is, I'm guessing that most of you have had this. It's basically a needle that kind of gets injected into your gum and it freezes the area so that the dentist can do the work and so that you don't feel any pain. So we're going to be looking at some components. This is basically an outline of what we will be covering. Again, here we're looking at an example of a local anesthetic. It's going in this area over here to numb the teeth surrounding that area, the teeth and gums surrounding that area. So way back in 1860s, people used cocaine as a local anesthetic, as a way to numb teeth. And here we see cocaine being administered to numb the area. Now we have found better types of anesthetics that we can use, better and safer as well. So when we're looking for an ideal local anesthetic, when we want to choose an anesthetic for a client, there are some things we should think about. We should think about how toxic or how strong or how potent the local anesthetic is. So is it safe? Is it reversible? When you get local anesthetic in your mouth, you want to make sure that it's reversible. You want to make sure that that numbness eventually goes away and you get feeling back, right? So that it's reversible. You don't want any allergies or any reactions happening after the local anesthetic. So an absence of allergic or local reactions. You want rapid onset. You want it to be fast, which means that as soon as it's injected in you, you don't want to wait an hour before it starts feeling numb. You want to wait just a few minutes before it starts feeling numb, right? So rapid onset. It should start feeling numb pretty much right away. And you want a good duration, which means that it should stay numb. The area should stay numb for maybe 2 to 3 hours, okay? Typically, dental work maybe takes half an hour, so you really want to make sure that the duration is at least half an hour. It should be sterilized. So this whole syringe, it needs to be sterilized by an autoclave. So these are properties or things we look for when we're trying to choose the right local anesthetic for our client. Now there's two types of local anesthetic. There's esters and amides, and all that really means is the chemical compound is different. So ester looks different compared to the amide. And one key word or one key tip that I've learned is that when you look at the amide, see how their eye is highlighted in green. The reason why that's important is because to distinguish an amide from an ester, if you look at the names of the local anesthetic, you'll see that there's always an I before the cane in the amides, right? So all these medications have an I before the cane, right? So articaine, the I is before the cane. Lidocaine, the I is before the cane, and so, same with all the remaining ones that are listed over here. When you look at these drugs, anytime you have the word cane, okay, at the end, then you know that it's a local anesthetic. So that's one tip that you can think of or keep in the back of your mind. And again, amides, when you see an I before the cane, we know that this is an amide, because in esters, there's no I before the cane. How do local anesthetics work? So if you remember from the beginning of the semester where we're talking about how pain gets transferred to the brain or spinal cord, what local anesthetic does is it blocks the pain somewhere around here. So it blocks the pain somewhere around this neuron, and when it blocks the pain signal won't be sent to the brain, so we won't feel the pain that way. And if you look really closely, so imagine there's axons over here, and if you look at this section over here, or look at this axon or this neuron over here, if you zoom in, you're going to see the membrane. Okay, so like the outer layer of the axon or the outer layer of the neuron. And typically what happens is when we feel pain, we have sodium that's just circulating on the outside. Okay, so sodium circulating on the outside of the axon. It goes in, and when it goes inside the axon or when it goes inside the neuron, it causes us to feel pain. So what local anesthetic does is local anesthetic goes inside the neuron and it binds to these channels. And when it binds to this channel, sodium can no longer go in because it plugs it. It plugs it so sodium can't go in, and sodium just bounces back out. And when sodium just bounces out, we won't feel pain. So this is just a very, very brief summary. There are obviously a lot more things happening that you see over here. I'm not going to talk about that. You won't be tested on this part over here, but just know that this is how local anesthetic works. I'll show you another picture and I'll just summarize it. The local anesthetic just goes through the cell membrane or the neuron, and it plugs the sodium channel. It plugs the channel, and when it plugs the channel, sodium, which is usually just floating out over here, will not go in. And when it doesn't go in, we won't feel pain. So when sodium does not go inside the neuron, we do not feel pain. And that's what local anesthetic does. It plugs the sodium channel so that sodium can't come inside. And when sodium can't come inside, we won't feel any pain. So let's look at absorption. When we get injected with a local anesthetic, absorption is important because what absorption is how the local anesthetic moves into the bloodstream. So we want a slow absorption. We want the local anesthetic to move into the bloodstream at a very slow rate. And the reason why we want a slow rate is if it comes really fast, if it goes really fast, it's going to feel more toxic. We're going to feel a lot more toxic. It's going to be harmful for us. So we need a slow absorption. We need the drug to move into the bloodstream slowly because that's more safe. It's less toxic that way. Fun fact, sometimes if you warm up the local anesthetic before injection, it actually reduces the pain. There used to be a thought where if you massage the area that's getting injected, it reduces the pain. But I just read a study recently saying that that's not true. But just know that, there are ways. So heating up the local anesthetic, or what it used to be thought that massaging the area would reduce pain. So in a local anesthetic, we like to see vasoconstrictor. And the vasoconstrictor that we normally see in our local anesthetic is epinephrine. And I'll talk more about that towards the end of the lecture. But just to give you an overview, the reason why a vasoconstrictor like epinephrine is inserted into the local anesthetic is because what the vasoconstrictor does is it constricts or closes the blood vessel. And why is that important? It's important to close the blood vessel so that the drug or the local anesthetic stays in the bloodstream or stays in that area for some time. If it just washes away, so if you have a local anesthetic without epinephrine and you put the local anesthetic inside, it'll just flush out, it'll just wash away. But if you have an epinephrine, notice how the blood vessel is now constricted. So here it's big, but here it's smaller and it's constricted. That's better because now the drug or the local anesthetic will stay here for a longer period of time. And when it stays there for a longer period of time, you'll feel numb for a longer period of time. And that's what we want. We don't want the numbness to go away really fast. We want the drug to stay there so that we can feel numb for a longer period of time. So this is just a recap of what we talked about earlier, where the local anesthetic, it can just go slide through. And local anesthetic, by the way, is usually lipid soluble. And if you remember, hydrophilic, right, and hydrophobic. So philic means that it likes lipids. So local anesthetic can just go and slide through the membrane right away, and then it would go plug in the sodium channel and block the sodium from coming in. So there are some local anesthetic that are more lipid soluble than others. So for example, this local anesthetic, bupivacaine, is more soluble, 10 times more lipid soluble than lidocaine. So that means that this bupivacaine local anesthetic will go through right away and will plug it in. It's a lot more stronger. We'll plug in the sodium channel and block the sodium from going in, and you won't feel any pain. The downside is because it's so much more lipid soluble, it's more stronger, it's more potent. And sometimes when you have a more potent or more stronger local anesthetic, it can be bad for you. It can be more toxic. So usually the safe one is lidocaine. And we'll talk more about that later on. So remember how I said there's two types of local anesthetic? There's esters, which have no I before the cane, and then there's amides, which has an I before the cane. And where are they broken down? So esters are broken down in the blood, in the plasma really, so the water part of the blood. And amides, they're metabolized, or they're broken down by the liver. So as it goes through your body, it finally ends with the liver, and the liver kind of maybe deactivates the drug or deactivates the local anesthetic, and then it gets flushed out through the kidneys and out the urine. So amides are metabolized or broken down in the liver. Ester is broken down in the blood, or plasma to be more specific. And then it gets excreted through the kidneys. So then after the liver, it goes into the kidneys, and then we urinate it out. Now, one of the downside with local anesthetic is that it can depress the cardiac contraction. So instead of your heart pumping nicely, it can slow down the pump. And that is a downside. So what's really important is what we say to everyone now is anytime a client needs local anesthetic, we really should be taking their blood pressure. Because if their blood pressure is too high and we administer local anesthetic, that's not good. There could be a medical emergency. So we really need to monitor that their heart is okay, the blood pressure is normal, so that we can safely administer the local anesthetic in the hope that there is no medical emergency. Now, when you inject a local anesthetic, one of the key things they teach you is to slowly inject. I know when I did this, so as a student, I graduated from BC, I had to learn how to apply local anesthetic. That was a really important thing that they stressed. And they said that when you inject it slowly, one of the reasons why it's really good is because it reduces the pain. So the client feels a lot less pain when we inject it really slowly. Another reason why you inject the anesthetic very slowly is because you need to allow the area or the gums to have room to accommodate the local anesthetic. If you just inject it really fast, then there's not much room, or there's not much chance for that area to accept all that solution. So inject it slowly so that it makes room for the solution to go into the area. Something to keep in mind is patient's weight. So the dosage is really important because a child's weight is lower than an adult's weight. So the dosage for a child will be very different from a dosage of an adult. And a side effect of the local anesthetic is CNS, or central nervous system stimulation and depression. What that means is your brain, central nervous system, think of brain, your brain can get really excited, and once it gets really excited, it can eventually turn into the depressive state where they could go into respiratory depression, so they stop breathing, and then coma could happen. So this is a severe side effect that could happen, where the brain gets really excited, stimulated, and then it gets depressed, and the breathing kind of depresses. And it could be dangerous, where they could stop breathing completely. They could go into coma too. Okay, so just to re-stress that your cardiovascular system, or the heart, is very important when administering local anesthetic, because it can depress the heart. You can get into a cardiac arrest. So monitor with blood pressure. Make sure the blood pressure is okay before administering local anesthetic to reduce the chance of any medical emergencies. Now, sometimes what happens is when a local anesthetic is administered, so in this case, the local anesthetic was administered over here, what can happen is that if it was injected incorrectly, if the technique was off, if they, for example, administered it too fast, for example, they didn't slow down the injection rate, a hematoma, which is like a blood bubble kind of, can form. Now, it's not harmful, but it's annoying. It's annoying. And the way this usually goes away is with time. We just let time heal this hematoma.